and the activities of your St. Kitts Nevis government. Join host Lesroy Williams as he presents news, views, reports, and interviews about everything regarding the activities of the Team Unity government and the building of our communities and the development of St. Kitts Nevis. Tune in and call in to interact with your government and share your views regarding the upward forward development of your community and our beautiful Twin Island Federation. Working for you ears weekly, every Wednesday live from 1:30 p.m. to 3 p.m. on ZIZ Radio, Win FM, and Sugar City FM with rebroadcast on participating stations. Working for you.
A pleasant good afternoon to everyone who has tuned in to listen to another edition of Working for You. I am your host, Lesroy Williams. This is the weekly radio program and television program where people can keep informed about issues relating to them, topical issues, and so on. Today, I am very fortunate to have with me in studio officials from the Ministry of Health, and we are going to speak about a number of issues pertaining to health in the Federation at the moment. And one of the most recent ones, of course, is that of the Zika virus. I will introduce the officials, starting at my left, and I have with me Mr. Alexander Riley, who is the Chief Environmental Health Officer. And then I have Dr. Hazel Laws, and she is our new Chief Medical Officer, the new CMO. And then I have Dr. Retna Walwyn Brown, who is the Acting Director of Community-Based Health Services, and Mr. Jermaine Lake, Deputy Chief Environmental Health Officer. Welcome to this program.
Thank you. Thank you.
Thank you.
It is indeed an honor to have you here. You seem as though we have the entire ministry. Okay. Now, what I want you to do first is I want you to give me a brief description of your role in the ministry. So I'm going to start with Mr. Lake first.
Oh, okay.
You are Deputy Chief Environmental Health Officer. What does that entail?
With responsibility for vector control and mosquitoes, vectors, rodents, rats and mice are vectors, so those fall directly under my purview as Deputy Chief. And I have other roles in terms of supervising other environmental health officers and any other duties that the Chief, Mr. Wiley, would assign to me from time to time.
Okay. Dr. Walwyn?
Good afternoon to everybody. As you mentioned, I'm the Director of Community-Based Health Services, and the Community-Based Health Services are services within the community. This includes your health centers, this includes your Department of Environmental Health, this also includes your health promotion unit and the dental unit and other administrative offices within the Ministry of Health. So my role is basically to manage most of these departments and to ensure that they carry out their daily activities. I'm also involved with policy and other administrative activities within the Ministry of Health. So that in a nutshell is what I do.
Thank you, Dr. Walwyn. Mr. Riley.
Good afternoon. Alexander Riley, Chief Environmental Health Officer. My role in the Ministry of Health is a very big one. I'm responsible for ensuring that the country is aware of the things that we need to do to ensure that we prevent diseases from happening in our country. For now, we see that we're having Zika virus, so I'll be telling you some of what our role is as is the ministry and what the public role is when it comes to helping not only the ministry but helping themselves in order to ensure that we have a safer and a healthier community.
Thank you. Now I left Dr. Laws for last because she is our new Chief Medical Officer. Of course, she is Kittishan.
Yes.
And I wanted to introduce herself and to tell us what her vision is for the Ministry of Health, what experience she brings to the job, and so on.
Good afternoon, everyone, and thank you, Mr. Williams, for your warm introduction. I see that you left the hardest for the last. Well, I am Hazel Laws, and as you rightly said, I'm Kittishan. I was born on Mansion Estate, and that's a rural plantation in the island of St. Kitts. I received my primary school and secondary school education here in St. Kitts before going on to Jamaica, where I got my tertiary education. I am a lecturer. I'm in academia. I have been a lecturer for the past 10 years at Mona, the University of the West Indies, Mona campus. My area of specialization is that of public health. I received my training also at Mona in Jamaica. I bring a number of years of experience working in community health and public health within the Jamaican context. I spent a number of years as the senior medical officer of health in a health center affixed to the university, whereby I was in control of providing health care to a population of about 26,000 Jamaicans. I worked at the regional level, regional health level, and also worked at the national level, done consultancy work for the Ministry of Health in Jamaica. So as I said, I bring to the table a number of years of experience working in community health and public health. My role at the Ministry of Health here in St. Kitts is one of oversight to the team of health professionals who are working in the Ministry of Health in St. Kitts and Nevis in the Federation, working at the community level, delivering community-based services, and working at the institutional level at the various hospitals in the Federation. So I see myself providing oversight to the various health teams, delivering health care to the people of St. Kitts and Nevis.
How do you feel to be back in the Federation after so many years?
I actually feel privileged to be asked to serve at this level. So I'm really happy being here.
And I'm sure that you're acquainting yourself again with some faces that you knew and so on. I mean, I knew you because where I lived, you had to pass my house when you were going down to my grandmother's house when you were going to the Mansion Estate. So I know you and I know all your brothers.
Yes.
Okay, now the Ministry of Health is a very important ministry. Of course, health is something that we cannot afford to play with. And we always hear that a healthy nation is a wealthy nation. And of course, health is tied to our development in so many ways. If people are sick, there's a loss in productivity, which definitely will lead to have some economic impact on families and the whole community and so on. So it is an extremely important area. And I know that the Ministry of Health is presently faced with some challenges. Let me put it as challenges. Especially now, we are hearing in the region that there's the Zika virus. And that brings its own challenges. And a response, of course, from, governments in the region, ministries of health, and, from people as well. How do they respond to this new Zika virus? And, you will have a response in terms of the Zika virus, the Ministry of Health, and you are here today to outline what is your response. But before that, maybe you can tell us, what is the Zika virus? What is Zika?
Well, as you rightly said, St. Kitts, Nevis, the Federation, and the region on a whole, we are faced with a number of health challenges. And Zika virus is one of the emerging infectious diseases that's posing a serious threat to the Federation and to the islands in the region. Now, Zika virus, it's a germ, a flavivirus, that an individual can pick up after being bitten by an infected Aedes aegypti mosquito. Now, it causes a viral illness that is characterized by a low-grade fever, a generalized rash affecting different areas of the body, feelings of malaise, lethargy, and the individual can also complain of joint pains, muscle pains. Another characteristic feature is that of conjunctivitis, non-purulent conjunctivitis, redness of the eyes. So these are the main symptoms of Zika virus.
I heard also that it is probably asymptomatic, in the sense that you can have it and you don't know that you have it.
Yes, a number of infected persons, actually the literature suggests that as many as 70 to 80% of individuals can contract this illness and not exhibit any of the signs and symptoms that I've just outlined. So that's possible.
And then especially with pregnant ladies, in some countries they're telling women that they should not get pregnant because of the danger of getting babies with small heads or microcephaly.
Microcephaly, yes.
Could you explain a little bit what that is?
Yes, pregnant females are particularly vulnerable to the Zika virus infection. And so yes, if a pregnant woman becomes infected with the Zika virus, she is at risk for a number of outcomes. She's at risk of having a miscarriage, a stillbirth, or if the pregnancy continues, she can give birth to a newborn with an abnormally small head, or as you rightly said, microcephaly. And at present, we don't know all there is to know about Zika virus, and so we are still in the learning phase. And so we can't say right now when a newborn is born with a small head, what their life course will be. What their experience would be in terms of developmental delays and other central nervous system abnormalities. So we are still trying to gather all the information we can about the Zika virus.
Sure. Now, Dr. Walwyn Brown, what is being done in the community to raise awareness in terms of this Zika virus?
Okay, so as Dr. Laws mentioned, the virus is relatively new, and so we use information that we've gotten from sources such as the World Health Organization, CDC, and these organizations that have persons doing research and gathering information. So as they release recommendations, we pass that on to our healthcare workers. So they're the first set of people that we share the information with, make sure that they understand, so that they are in a position to assist the public in terms of education and any information that they may have. So once we've given our health team that information, then we spread it to the rest of the community. That would involve the distribution of pamphlets, one-on-one conversations with your healthcare provider, forums such as these, forums that persons can get information and at the same time share their concerns. So that basically is some of the methods that we use to share information with the public.
Sure, and we have two environmental health officers here, Mr. Lake and Mr. Riley. And of course, we know that the environment can contribute so much to diseases. And a clean environment or a dirty environment, we know how much the environment is important to the prevention of the diseases or towards the contribution of diseases. We have diseases that are airborne, we have diseases that are vector-borne, and so on. Now, in terms of the environment, what advice would you give in terms of creating an environment that is conducive to the reduction of the contracting the Zika virus and so on? Mr. Lake.
Aedes aegypti is a sort of discriminating mosquito in that she doesn't breed in
It's a she.
yes, it's the female mosquito that lays the eggs. Primarily responsible for the female mosquito is primarily responsible for vectoring Zika and other diseases, and Aedes Aedes aegypti in particular breeds in clean, clear water, and man generally has clean, clear water around him and prefers not to have dirty water around him, and so Aedes basically lives where man lives.
Yes.
You won't find much, if any, Aedes up in the hills outside of the residential areas, for instance. And what happens when persons keep tires, bottles, cups, and other places around, other items around them which can hold water, Aedes finds its way there, harbors there, and lays her eggs there. And it's mostly tied to sanitary conditions. I've been doing some work with a guy at Ross University, and one of the things he pointed out to me is that almost every instance where he went with a little vacuum-like machine, almost every instance where he went to try and capture adult Aedes mosquitoes were unsanitary. They had a lot of containers around, the yards were unkept, or some other thing similar. And he would go to quote-unquote cleaner or clean residents, and it would be difficult to find Aedes, adult Aedes, on these premises. So it's basically a given that if you're keeping the place unsanitary, you're going to have mosquitoes around.
Is the Aedes aegypti mosquito the only type of mosquito that carries the Zika virus?
As far as we know at this point, yes.
There's no other type of...
The albopictus,
yes. Aedes
mosquito,
albopictus,
it
yes.
also carries the Zika virus, but as far as I know, I
do not
don't
have
think we have the albopictus species here.
Okay, but that also
Yeah,
carries
that
the
also
Zika
We
virus.
don't
carries
have
the
it here,
Zika
no.
virus. Yes.
No, this same mosquito that carries the Zika virus, does it also carry the chikungunya?
Yes,
Yes, it
And
does.
the
And the
dengue.
dengue
And the
virus.
dengue,
Yes.
and
Oh, I
yellow
see.
fever as well.
Yeah.
And
But
yellow
we don't have
fever.
yellow fever here.
Yes, yes.
And there is no vaccine against the Zika virus
No.
at
Not
the
as yet,
moment.
no.
Not as yet,
Not
because
as yet.
it's pretty much new.
Yes.
Is it a new virus?
Yeah.
New to the region.
It's
or
new to the
hemisphere.
region.
Yes.
Okay. Now, you outlined that in terms of keeping one's environment clean is very paramount to the reduction in terms of the breeding of the mosquito. Now, Mr. Riley, what are some of the things that you would ask that people do to prevent the breeding of the mosquito?
First and foremost, I would like to look at the mosquito itself and go through the life cycle of
Sure.
this mosquito, because it's very important. As Mr. Lake indicated, the mosquito is domesticated, so it lives in and around our homes. Now, since the Zika virus, I've been getting many calls that any mosquito bites somebody right now, it's an Aedes aegypti mosquito. And the first thing they're saying is that they got Zika. The Zika mosquito biting. Please note that, yes, we do have the Zika mosquito, but we do have other mosquitoes in the Federation. Even though we don't have the Albopictus in St. Kitts, sorry to say, but it's on Nevis. So we have it in the Federation.
Also, it is in Nevis.
Yes,
What if it's in Nevis? It's going to reach down here.
Yes, it is in Nevis, but not in St. Kitts. That's just a correction. Okay? But the mosquito has a life cycle of 4 stages. Now, if we have an environment which presents itself for collection of water and for mosquitoes to lay their eggs, you'll find that within 10 to 7 days, you will have adult mosquitoes after the egg is being hatched in the water. Now, the mosquito is also smart, even if we don't want to think so, because the mosquito does not actually lay the eggs in the water. It lays it on the surface of the container.
Oh.
So when the water level rises and the eggs are submerged, then they hatch.
Oh.
And they go through the stages of the life cycle in 7 to 10 days. So imagine a mosquito laying eggs 3 to 4 times a week once it gets a blood meal. Then you know what we're having. So it is very important that the general public and even our officers, when they go out there, to ensure that anywhere that can breed mosquito, we try to educate the persons, because some people might be storing water for other purposes. So we have to find a way to get them to understand that even though you're keeping water for some other purposes, it's important that you take the necessary steps to ensure that you don't breed mosquitoes. Now, as little as a cola stopper can breed 1 million mosquitoes in less than no time. So we can't take anything for granted. We are aware of the fact that we have situations out there. Premises are kept very unsanitary. We also have the issue of empty lots. The empty lots, people might think that they can't breed mosquito, but they do breed mosquitoes, because what we find is that because of some of our cultural habits, bad habits, we tend to dump things on people a lot.
Yes.
And it's very important. We are not creating an environment that is conducive for us, but it's conducive to the vectors that can transmit diseases. So I would just like to say that, please, if we're going to safeguard ourselves, we have to safeguard our neighbor. It doesn't make any sense that we clean our yard and dirty up somebody else's lot, which will then create a situation whereby you will be affected and the neighborhood will be affected, and once the neighborhood becomes affected, then you have the whole island being affected. So it's very important that we go out there as officers and ensure that we do what we are supposed to do, but also the general public has a part to play in it, because they are the ones who most of the time are affected. So it's important that they play the role and ensure. Don't be afraid to tell on your neighbor if you know they're doing something wrong, because our responsibility is to ensure that whatever we do and you see, we correct it for our health and safety.